right, so we're going to practice a little bit. I am going to give you a statement, and then I would like you to tell me what would probably be a better response. Okay, here's my statement. Well, that doesn't make any sense. What would be a better statement? E. Kaylin chose E. Remember, we agreed to respect all opinions. What do you guys think? Better? Perfect. That's exactly what I would have chosen. Okay, how about this one? You're in a group with a bunch of mothers, and one of them says this. Well, if you want to stop diarrhea, don't drink anything. Don't give your kid anything to drink. Yes, Janice. Okay, Janice says F. I'm glad you brought that up. It seems so obvious, but actually that practice is really dangerous. You agree? So do I. Much better. Much better. Okay. I don't think this discussion is getting us anywhere. Okay, who said A? I heard an A. Kennedy. Okay, Kennedy said A. Well, how do others feel about the discussion so far? Do you agree with her? Mm-hmm. So do I. Much better. You are, oh, actually, oh no, never mind. You're holding a class, and you've noticed that there's little conversations going on. You're starting to lose the attention span. There's numerous side conversations going on. What might you say? Sean? C. Okay, good. Do we need to take a break? Good. You're in a parent class, and one of the parents says, well, if he doesn't eat dinner, just give him anything else to eat for the rest of, just don't give him anything else to eat for the rest of the night. Yeah, Kelly. Okay, Kelly says, B, that's one way of handling the problem. Does anyone else have an idea of what to do? You like that one? Yeah, I think that's good. Okay, and one last one. You have somebody who is just the silent participant. They haven't said anything all evening long. What do you say? D, okay. So you might ask them, what do you think about this issue? Okay, very good. Okay, we have some scenarios to look at. You're on a dialysis unit, and Leanne's not here today. I even put her name up there. Leanne is facilitating a group discussion in a kidney dialysis unit on dietary needs for individuals with diabetes who are receiving dialysis treatment. One of the participants, who looks bored and has previously attended a similar program, states, "This is a waste of time. How's this supposed to help us?" How do you think Leanne should respond to that? There's no one, just give me ideas. What would you say? There are many different ways that you could respond to this. Yes, Nicole.
Something like, how does everybody else feel about the discussion? And then maybe ask that particular person, like, what would you like to talk about that we haven't covered?
Okay, that's an idea. Good. Anybody else? Sean. Oh boy. I don't know about that one. Maybe you are the class clown. It just took you toward the end of the semester. Okay, yeah, I don't know if we should be just jumping right into that asking people to leave thing. Kaylin.
Ask if they're not sure how the information is supposed to help them with clarification or anything. Or,
Very good. That's good. Anybody have anything else to add? Rachel? Heather, you're sitting over there, and Rachel.
When I'm over there, you're right. Well, if you know they've been to a similar program, then they might know some of the information, so they can engage. You can ask them in a way to kind of teach something.
Oh, I think that's excellent. Yeah, that's a very good idea. Anybody else? Okay, let's move on. I think you came up with a lot of good ideas. You guys are nice people. You're going to handle this well, I can see. Okay. This scenario is in a rehab center, and Kelsey is facilitating a group of patients who have experienced a heart attack. One of the participants is monopolizing the whole conversation. None of the other group members appear engaged or anxious to talk. What should Kelsey do? How should she handle this situation? Putting you on the spot. Both of you. Anybody want to help Kelsey? Our Kelseys out here. What would be a good way to handle this situation? This is actually one you're going to run into. Janice?
You can say something like your comments are very helpful or contribute a lot to the conversation. Does anybody else have anything they want?
Okay, good. Anybody else? Different way of handling it? I think that probably is the only way to handle it, to be honest. I think that's what you're going to have to do. Okay, scenario 3, you sports nutritionists, okay? You are holding a session on healthy eating at a local sports club, and one of the participants just looks bored. They're looking out the window, and they're making you feel a little inadequate as the instructor, the facilitator of the group. What should you do? What should David do? You want to give David advice about what to do? Yes, Cassie.
What do you think about this topic?
Okay, asking them if they have anything that they want to add. Usually when you do that, they become engaged really fast. They really do. It doesn't matter what group situation you're in. If you ask somebody for their opinion, they become very heightened with regard to their attention span. Sean.
Do they know that it's like you know that they weren't paying attention and asking for input?
No, I think that you need to handle that carefully, but I think you can get away with what she said. But you bring up a good point. You do need to consider that. You don't want to offend anybody. And don't forget, usually people don't have to be there. It's usually voluntary. They signed up for this. So if they get treated poorly, they're not coming back. It's not like they have to come. It's not like they paid, $2,000 for the class and they have to come so they can get 3 credits. You know what I mean? Okay, well, anyway, that's how you deal with groups. Next time we are going to actually practice this, and you're not going to have to listen to me anymore. If anybody has, didn't pick up their midterms, don't forget to pick those up. And if anybody has their project finished, they go on this side. Have a nice weekend.